Harvesting organs from assisted suicide. This is Canada's Maid program. We've been talking about it for years. Recently, the first heart transplant was transplanted from a euthanized person into a 59-year-old American man with heart failure. Now, this is not the first organ that was harvested from the Maid program, but it is the first heart. Now, we're going to get to all of the many ethical issues in a second, but first, one of them is national. How did an American man get access to this heart? Well, according to reports, the organs are supposed to be allocated to a wait list and supposed to go first to patients in Ontario and then wider Canada before it can be offered to the US. So are you telling me that no other Canadian needed a heart? That this person volunteered to donate their heart and it went across American borders because there's no one in Canada who needed this? Well, that sounds statistically improbable, doesn't it? Canada has hundreds of patients on the cardiac transplant list at any time, according to the Canadian Institute for Health Information. As of late last year, about 190 Canadians were waiting for a heart transplant. So if I were Canadian, I would be very curious how an American skipped the line. Wouldn't you? Hearts are extremely scarce. Recipients wait years for a transplant. So for this heart to have not been needed by a single Canadian, that's strange. That sounds strange to me. It doesn't sound right. Now, think about the timing of this. This is also very concerning. The patient is told, hey, someone's willing to die for you and give you their heart. So you got to get your butt into surgery at the same time this person's dying, and you accept that ethical quandary. Yep. Okay, I'm going to take it. Now, look how they report this timing. They say that within 7 minutes of death, the team said, yep, that person's dead. We're all good. They carve him up. They have the heart transplanted across the border. 6 hours later in Pennsylvania, that heart's put into a new person. Now, I don't know about medical practices in Canada, but this short period of time, 7 minutes, gives me pause, especially after in America, HHS Director RFK Jr. released this report in July showing that U.S. hospitals have been harvesting organs from patients who were, in the words of Monty Python, not dead yet. This is that report. It showed that in the hundreds of cases that HHS reviewed of organ donations, nearly 1/3 of the patients were not fully dead yet when they started taking the organs. They showed, quote, neurological signs incompatible with organ donation. In other words, still alive. Now, we don't know if this is done in Canada, but it sure would give me pause if I had been